A significant number of individuals are in quarantine as health officials continue to monitor their movements with the assistance of the newly established COVID-19 Enforcement Unit. Lloyd Island spoke to Deputy Chief Medical Officer Dr. DeLon Brennan about the quarantine process.
What happens in our workplaces is there are often persons who've been exposed on the outside in maybe a social setting or in their family setting that then most of them not knowingly will come to work, and then they get diagnosed at some point later with the disease. And what that means is at that point, once they have been diagnosed, that we have to look at their contacts, and once we identify who their contacts would be, including at their jobs, we then have to inform persons that they may have been in contact, and confidentially, may have been in contact with an identified COVID-19 positive case, and we then suggest that they quarantine at home, or if they are unable to do it home, in another facility, for us to make sure that if they were to develop symptoms, they wouldn't then be exposing an additional group of people to it. When they are doing so at home, what it requires is they have to have a place where they can have their own bedroom, and they're not going to expose a bedmate or someone else, and ideally have their own bathroom. If their home meets that criteria and there's a caretaker who can bring them food and make sure that there are no other exposures, then it's okay for them to do so at home. However, if that is not possible, then the government does provide locations where we would be able to provide a number of people with the ability to isolate without exposing others outside of their home environment.
And keying into that idea of quarantine, we know that it's generally a 14-day period. During that time, are there any signs of worsening that a patient should look for?
Absolutely. So, one, we're going to stay in contact with those individuals, and as we've enhanced our contact tracing capacity, we're in contact with individuals on a daily basis. So we're asking them about those signs and symptoms, and of course that includes any signs or symptoms that would be suggestive of COVID-19. Those might include fever, cough, shortness of breath, sore throat, muscle aches or pains, just generalized fatigue, vomiting, diarrhea, like any constellation of those symptoms. It would be important to let the contact tracing grouping know, or your medical provider know, because at that point we would need to have you tested, because we would need to see if you are, because of that contact, you are now developing the disease of COVID-19.
And also, on Sunday, the Prime Minister spoke of deciding to contain conditions of restrictions in San Salvador because of a pending case, but we know that Inagua was given the go-ahead to operate generally with lesser restrictions. Talk to us about that pending case in San Salvador and also in Inagua. When did officials first learn of the case or possible case there?
So in the San Salvador case, that is still pending. We haven't received a result for that one yet, so can't really discuss too many details on that one. But the case in Inagua, there was an individual who was experiencing symptoms, and so that person was actually brought into the capital, so they're not actually in Inagua at present. So they came into New Providence, and they were able to be evaluated at the hospital, and upon evaluation, the decision was made to obtain COVID-19 testing, and it has now returned as positive. So because the person was resident on Inagua when they first started experiencing symptoms, that case is attributed to Inagua, even though the patient isn't currently on the island of Inagua right now.